Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop peroneal tendonitis pain or relieve peroneal tendonitis pain. But before I do that, I will explain what is peroneal tendonitis, symptoms, causes, risk factors, and how to treat the root cause of peroneal tendonitis pain. So what is peroneal tendonitis? Before I explain the tendonitis, we need to understand that peroneal is a three muscle. It's a muscle group that attached to the side of your leg. You can see it here in this image that it consists of peroneus longus, brevis, and tertius. So you can see it's all attached to the fibular bone on the side outward of your leg. So in this model, you can see the fibula bone that's attached here all the way to your knee, and this is the outer side of your leg. So the peroneal muscles attach on the fibula here, and the longus wrapping around all the way to the bottom of your foot. The brevis is attached all the way to here, the metatarsal, the fifth metatarsal, and the tertius is inside. So these are collectively called the peroneal muscles, fibrillus muscles. And it's the same thing, the peroneal is the fibrillus muscles, and it's attached from the side of the fibula and going all the way down to the foot. So what are the symptoms of peroneal tendonitis? So by definition, anything has itis is inflammation. And typically when you start to have inflammation, there's always a scar tissue with it. So with peroneal tendonitis, you might experience pain on the side of your leg and your foot, swelling in this area, ankle instability or weaknesses. These are very common symptoms of the peroneal tendonitis. And usually your pain increases with weight bearing when you put weight on your foot. Some of the patient could experience some pain in the back of their leg and foot and ankle. When someone has pronated foot, their foot collapsing inward. If someone has excessive supination, the foot is collapsing outward. And especially supination is a risk factor for peroneal tendonitis. So what are the risk factors? Well, the foot anatomy, if you have excessive supination or sometimes pronation, that could increase your risk of having inflammation in the peroneus muscle that actually cause wear and tear in that muscle for overuse. Also, if you wear bad shoes, high heel, risk factors, and if you have a bad anatomy and you do sports, that increase the chance of having issues, because it's like your car out of alignment. You put more mileage on it, you're gonna have more wear and tear and damage and issue with it. So improper training techniques, if you really do training that's really not with the supportive foot or bad mechanics, that could cause actually peroneal tendonitis, and you can see it here on the outer side of your leg and foot. So how to treat peroneal tendonitis? Before I answer this question, we need to understand the normal healing cycle, because it will make a lot of sense why we have to work on the healing cycle instead of just masking the symptoms. And then I will go over the current treatment and what you can do at home to really relieve or stop peroneal tendonitis. So I'm gonna use external paper cut for visualization, but the same process happen internally from accident, trauma, poor posture, poor body mechanic, or when you wear high heel or you have supinated foot or pronated foot. So the first stage of healing is inflammation, swelling, redness, and the blood starts to rush to that area. And we know by definition, tendonitis is inflammation in the tendon. The second stage of healing is a proliferation stage, and you can see here your body starts to build a scar tissue. That's happened internally in the peroneus muscles. During this stage, there's a cascade of events: scar tissue, fascial restrictions, muscle spasm, trigger points. The last stage is a maturation stage. That's when your body actually starts to get rid of the scar tissue, the fascia restrictions, and clear up everything. This is perfect scenario. If you have peroneal tendonitis, you're probably going back and forth between inflammation and proliferation. There's some inflammation. You did overuse the muscles and the tendon by pressure, by bad anatomy. You cause a micro tear internally, so your body builds the scar tissue, and when you start to palpate on your muscle and tendon, you will feel thickness. That thickness, that's a sign of scarring in that area, but too much of that scarring will cause restriction. Why? Because our muscle should act like a rubber band. When it contracts and relaxes, stretch like this. So when you have a scar tissue, it's like you have a knot in the rubber band. So when your muscle contract, will not stretch much, and that restricted the range of motion, compress on nerve and artery, could cause more symptoms. So to treat peroneal tendonitis, we have to really break this vicious cycle from both in the inflammation and the proliferation, and work on your body mechanics and proper gait. So I'm gonna go over some of the current treatment that been used but does not work very well, so you don't have to waste your time on it, and it will make a lot of sense when we relate that to the healing cycle. So one of the common things that use ice and steam and heat, and when we look at the healing cycle, it's not gonna do much. Based on a study, it provides temporary pain relief if you're lucky for half an hour, but it's not gonna do much for inflammation. It's not gonna break the scar tissue, fascia restriction, do much to the proliferation stage. The other thing that's commonly used is massage and foam roller, and I'm gonna combine those together. Based on the study, it either provides short-term pain reduction or no pain reduction. And when I go over the fascia system, it will make a lot of sense why these treatments are not effective. But here's the issue. If you have inflammation and you rub it with a foam roller or massage, you're gonna inflame it more, you're gonna make it worse. The other thing that commonly used is stretching, and I personally do not recommend stretching to my patient, because based on a study, it actually does not provide benefit. But if you overstretch, it's actually gonna cause micro tear in the muscle that will cause more inflammation and cause more scar tissue. There is actually more harm from stretching than benefits. So that's why I don't recommend it to my patient for any condition. There is other safe alternative option we can do at home than stretching. One of the other things that use a joint mobilization or adjustment or manipulation used by physical therapist, chiropractor, occupational therapist. But when you look at the healing cycle here, moving the bone itself is not gonna do anything to the tendonitis or the inflammation. That's actually could cause more inflammation, and it's not gonna break the scar tissue. It's not gonna release the fascia. It's basically working on something different. And based on the study, it provides either temporary pain relief or no pain relief. So the other thing is strengthening exercises. I don't like to do that initially, especially if you have inflammation, because if you have inflammation, that will inflame it more. We have to decrease the inflammation, break the scar tissue, release the tightness, and instead of doing strength exercises, I do function training, gait training, to walk properly, correct the arch. There's exercise we can do to correct the arch. I will cover it in other videos. So that's more effective than just strengthening exercise, doing ankle pump or just ankle exercise, which is not very effective to improve the function activity. So we need to focus on function training instead of strength exercise on the right time. So what should we do? We have to look at the healing cycle from those two ends. We have to address the inflammation, and we have to address the proliferation to get to the root cause of the problem. So what I personally do for inflammation, take it easy. If there's a lot of walking, walk less, avoid the motion that aggravated. If you do any training, I will refrain from the training until we decrease the inflammation, breaking the adhesion, and then we'll start to do the training when we correct the foot anatomy. That should be done first before training or exercising. So What I personally use a Magna Heel 2. This is actually very strong magnet that the magnetic range is about 3 inches, and that's what I personally give it to my patient to use it to penetrate in the body to decrease internal inflammation. I like to give all my patient anti-inflammatory diet because there's certain food that cause internal inflammation and slow down the healing. The other thing, if you have severe deficiency, your body gonna be slow to heal, to move from inflammation, proliferation to maturation. If you have B deficiency, C, D, K2, magnesium, and other vitamins and mineral, that process will decrease significantly. So one of the things you can do right now, actually go to askastr.com. It's a free online medical evaluation. It takes about 5 minutes, and the software will guide you what possible vitamins, mineral deficiency you might have that you need to address, so your body will be healing normally instead of slow healing. So I usually address all of that simultaneously to make sure your inflammation under control. But at the same time, we have to work on a proliferation, because by the definition is actually you're gonna have some thickness, which is scarring or fascia restriction in that area. So to do that, we need to break the scar tissue, release the fascia restriction, and trigger points. So you can see here in this image, like normal muscle should look like nice and smooth like this. When you start to have tear, you will have a torn and strained muscle that the strain is actually look random like this. And when your body start to build the scar tissue, the scarring actually going to be very, very random like this image. And actually you can do that now to see if you have a scar tissue. Push down on your peroneus muscle. If you start to feel a nod or thickness in the tissue that's hard to push, that's not pliable, there is a very high chance that's a scar tissue, and that will limit the peroneus muscle from stretching. So we have to work on the superficial and deep scar tissue. So what I personally use is A3 to release, break the superficial scar tissue, and then I use the A5 to really go deep enough to break the deep trigger point scar tissue and release the fascia restrictions. So the other thing that's overlooked, and I'm just gonna cover it briefly here, is the fascia system. The fascia system, the superficial layer fascia, is covering the entire body. It's like a Spider-Man suit wrapping the entire body, and you can see it here. The white tissue is the fascia layer in the cadaver here. Actually, when you get your next time the fresh meat, you will see the white filament. That's actually the fascia layer, and you can see there is several layers, and that is a very common issue with the peroneal tendonitis, because when you have a scar tissue, those fascia layers start to stick to the muscle and it prevents movement. When you start to have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small, so it's gonna prevent normal movement of the muscle and the tissue. So why it's important? Because if we break the scar tissue without releasing the fascia, it's not going to be for recovery, because when we look at the healing cycle, this is part of the problem of the proliferation. We cannot pick and choose. To make things complicated, but don't worry, the treatment very simple. We have 2 big categories of fascia: superficial layer and deep layer. And the deep layer divided to 4 subcategories, and each of these layers actually has 2 to 3 sub layers. So that's why I'm actually saying massage and foam roller are not effective, because mechanically impossible to go deep enough on those layers and distinguish between them with your hand, because your knuckle or your elbow not gonna go deep enough to do deep adhesion release. And if you cannot exert mechanical force on the fascia layer, you will not be able to release it. It's basically you wanna unscrew a screw in the motor, but your screwdriver is very short. That's why massage and foam roller does not work, because it's very superficial. So the deep fascia layer divided to 4 layers. The apparatic fascia, it wraps a group of muscles. And then you have the epimysin, you can see it here wrapping each individual muscle fiber. Then the premiysin wrapping each individual, like a group of bundle of fibers, and and then at the end, the endomycin wrapping each individual fiber. And that shows you how complex this system, and the treatment have to address all of that, because when you have tendonitis, usually everything is stuck together. The scar tissue make those tissue adhere together, so we need to really release all of them, not just pick and choose with massage or foam roller, releasing the superficial layer and leaving the deep layer, because that will continue causing restriction and inflammation. So what should we do? It's very simple. What I personally use is the A3, the A1 to release the superficial and aportic fascia layer, and then I use the A5 to release the epimycin, premiycin, and endomycin. So what should you do at home? Well, first we need to really get the inflammation under control, avoid the motion that actually aggravate it. And it's very common with those patients, your walk gait pattern is not correct, so we have to work on correcting the way you're walking. And if you have arch issue, we have to correct that. Some patient can be corrected with exercises. I will have it in the future video. And other patient we cannot correct it with exercises. We just have them to wear orthotic to correct their bad anatomy. At the same time, while doing the correction, we have to work on inflammation and proliferation stage, clear it up. We cannot choose which part of the treatment to treat, because it's not gonna work this way. We have to really address all of these simultaneously for the best result. Because if you work on correcting your posture and doing exercises for that, those exercises will not break the scar tissue. It's actually gonna cause more inflammation. If you work only on the inflammation and you did not work on the scar tissue, you still have the restrictions. So we cannot pick and choose which part of the treatment to treat. For best result, we have to do the whole, to address the whole system. So, and that's conclude how to address peroneal tendonitis pain. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.